What I discovered was in Sheridan, Iowa, empathy with efficient, educated medical healthcare professionals created something that turned my whole world around. And I mean that in every sense of the word. You have to understand where someone's coming from them in order to treat them. It's an environment that is small enough you have that personal touch, but the efficient manner in which Paige and Dr. Sundquist and the whole team created was something that turned the thing around. Paul Harrison, I started 2023 with stage 4 kidney cancer that went undetected long enough that it actually had transferred to my lungs, and we were worried about it going to my brain. On February 15th, I had a kidney removed and a surgery that went bad. A couple weeks later, I sneezed in high V and had a hole the size of a golf ball in my incision. That same surgeon did an emergency surgery that also went bad, ending in an infection. You're hit by two sides. The surgery went bad, everything's delayed. I was told going in, we got to get this done fast so you can start the treatment because my cancer is growing quickly. So in my head, I keep hearing those words, your cancer is growing quickly, but we can't do anything until you're healed. Well, prior to walking in the door, I wasn't healing, I was going the other way. I'd never heard of a wound specialist as a title before. It's either a doctor or a surgeon or something. I'd never heard of that till I came here.
The wound clinic is there for, anybody that has a chronic wound. We see a lot of diabetics, we see a lot of people with vascular disease, but it's really anybody that's got a wound that's long-standing and isn't healing properly. Because that's really what it's all about, is trying to figure out, what's causing this and how do we fix it.
A lot of people have never been to a wound clinic to be seen or treated for something like this, so most of it would be nervousness, anticipation. So we just try to put that at ease within the first visit, let them know how things are going to go, and work with that.
No appointment, no nothing. I just walked in the door at 5:30 in the morning. It said, here's my problem, and I showed them what we were dealing with. They jumped on board. From the first nurse I met with to the on-call doctor overnight to, I actually was lucky and just really lucky that Dr. Sundquist, the wound specialist here, happened to be on duty that morning, and he was the first person I seen, and frankly, that was the turning point.
With my background in trauma in the military, served 3 different combat tours. I've seen several wounds that were, needless to say, large. So having dealt with large wounds in the past, have enjoyed thoroughly working in the wound clinic. It has been a good environment. I love doing procedures, and it keeps me in touch with patients that are in need.
Everybody growing up has had a scrape or a wound at some point, and it always heals, where these people that come into the wound center, they sit there and stare at a wound for months and it doesn't heal. So, a lot of them are in a panic mode at that point.
I went from hopeless and pain, couldn't really function at all. I went from not being able to do anything to suddenly feeling good enough to start doing stuff. Literally a couple weeks later, I was mowing pastures on the tractor and stuff and feeling like I could do something again. Now I got a ways to go in this cancer battle, but I ain't been in a recliner waiting to live or die, except for the couple hours I spend in their recliner every couple weeks getting an infusion. Again, using the analogy of as a mechanic, anytime that you work on something someone else did before you, that's a challenge. There wasn't even a hesitation. Just figure out where we're at and move forward. And we've done that. I'm a small town guy. This is my world. I love small town. I love knowing everybody in the infusion center. I know what their hobbies are. how their family's doing. That's important to me. But I also think there's a stigma out there that people think if you go to a small town hospital, you don't get big town service. Well, I got more services here in a more efficient manner than I've ever received anywhere, ever.
Rural access hospitals, by far, have a better patient relationship than a larger institution. Patients learn to trust you because they know who you are. They build a relationship with you because they're your neighbors. They don't trust going to a hospital sometimes, so they want to trust you as a person.
I mean, I was talking about mini Holstein calves and skid loaders with Dr. Sundquist, mainly because I was using an example like I just used with you. I trusted him just simply because of his answers. He took the time to explain to me what we were going to do, why we had to do it. I think that's huge.
I just think the care that you get here and that we get to know our patients on a one-on-one basis and really work together with them to accomplish our goals, heal their wounds, it's pretty special.
You know, I'll do anything I can for the patient. I try everything, I exhaust every measure that I can in order to get them healed. And like I said, you know, our success rate's very high. Some people take a little bit longer than others, but for the most part, you get people healed.
Being able to help someone attain closure and the satisfaction that they get out of it is all rewarding.
I want Lucas County Health Center's Wound Center to be known that we are here, and when people hear about it, I want them to know that good things happen here and it's not scary.
What drives me, I mean, I think it's a tough system to navigate for most people that need it the most. It was just important to me I did something to make sure that the next person can receive the same, and the next person, and the next person. The level of treatment on every level efficiently that I got here was it's unbelievable. People need to know that.